The flu is holding a tight grip on Central Texas.
And it's not just children. We're seeing more reports of adult deaths. Travis County now says at least 32 people have died so far this season. All of them are adults, more than half over the age of 80. And that number is likely to rise because flu season's not over. It's not been this deadly in years.
In the classroom, students are out sick with the flu, and so are teachers. Some local school districts say the virus is making it hard to find enough substitutes to cover all of their classes. KXAN's Lauren Landman shows us how challenging it has been for the Hays CISD.
They work closely with kids every day.
See if you can figure it out.
So it's safe to say teachers are bound to pick up a germ or two.
We've got some that have the flu, their children have the flu.
And subs are in short supply. In recent weeks, the district has been left with around 30 unfilled teaching spots, some days getting close to 50.
In general, we're not in a crisis at this point at all, but we are seeing a few extra unfilled positions this time of year, and that's likely because of flu.
In some cases, the district says substitutes have to fill in for other subs who have the flu. But this isn't just a seasonal problem. The district says there are unfilled positions all year.
It's 2 or 3 times a week that I typically am subbing.
Turning what's intended to be a part-time job into something much more.
Most people, if they wanted to make it a full-time job, probably could work every day that they're interested in working.
And when there's not a substitute to fill in, school leaders say there's always a plan B to make sure students keep learning.
If there's one class, we might split the class until we can get somebody. Sometimes our interventionist and our instructional coach, when they have their off periods, they'll help cover so we can keep a class together.
Lauren Landman, KXAN News.
Hays CISD recently increased substitute pay to $90 a day. The district says the change has helped with the number of unfilled positions. We've got information on how to apply in this story on KXAN.com.
Dell Children's Medical Center saw a record surge in flu cases last week. That's when doctors treated nearly 380 children in a 24-hour-long period. Dr. Eric Higginbotham runs the emergency room there. He says this year's strain is much more infectious than in previous years. January was the worst month by far, and so the hospital set up an additional wing with more beds. Doctors haven't had to use them yet, but that may change. Dr. Higginbotham says most of the children admitted to the hospital are dehydrated and need extra fluids. But he believes the good news is his staff members are not seeing other life-threatening complications that come with the flu.
The biggest complication we've seen in years past is a kid gets the flu, their immune system gets down a little bit, and then they develop a pneumonia on top of that.
And Dr. Higginbotham says that can lead to potentially dangerous staph infections, but health workers have not seen those complications so far this year.
One glimmer of hope, flu researchers at UT think there's a good chance flu season may be at or near its peak. To predict what happens next, the CDC is tracking influenza-like illness. As of Sunday, almost 13% of people showing up at doctors' offices and health clinics in Texas had flu-like symptoms. The area shaded in blue, that's the range researchers expect to see when the CDC releases new numbers for Texas tomorrow. Most expect it to stay the same or start to fall. If it goes up, that's a big concern. UT flu researcher Spencer Fox tells us that means it would reach the pandemic levels last seen during the 2009-2010 season.